Hi, I'm Meg Fisher. I'm the medical director of the Unterberg Children's Hospital at Monmouth Medical Center, and I'm a pediatric infectious disease subspecialist. What I'd like to talk to you about today is your child's immunizations during this COVID-19 pandemic. The coronaviruses are very common viruses across the world, and usually they just cause the common cold and not much serious disease. However, this novel strain of coronavirus, which is now called COVID-19 or the SARS-CoV-2 virus, is a novel strain. It's a strain that developed as a combination of the bat coronavirus and the pangolin coronavirus. And the pangolin is a spiny anteater. This outbreak started in Wuhan City in China in December of 2019. The World Health Organization declared a public health emergency on January 30th of 2020, and soon after the US declared a public health emergency as well. It wasn't until March 11th that the World Health Organization declared a pandemic, meaning that this disease had spread throughout the world and was occurring in multiple countries and continents. This is a graph from the Centers for Disease Control and Prevention that shows how many countries of the world have been involved. And as you can see, it's pretty much everywhere. There are a few gray areas, and those really are areas that have not reported their cases. We think that literally this virus is everywhere in the world except Antarctica. This is a map of the United States, again from the Centers for Disease Control. And the darker your state color, the more COVID-19 disease is in your state. And as you can see, New Jersey and New York and Pennsylvania all have very high numbers of COVID disease. In fact, New Jersey has about the second highest number of cases of anywhere in the United States. But the good news at least for children, is that they have really mild or no illness at all. So this is great news, but unfortunately we know that their parents and their grandparents are being affected by this disease. We also know that to slow down the spread of this infection, everybody is staying at home. And we think that that has been important in finally slowing spread of disease. However, essential travel is allowed. And this travel includes going to get food or to your grocery store, and it also includes going to get health care. And we know that children need regular health care. Pediatricians are doing everything they can to safely care for your children. A lot of times they're using telemedicine. This means that by a phone call or by Zoom or by some other way, they can get in touch with you and have a visit with your child. However, there are some children who may need to be seen in person. For newborns, it's important that these children be seen soon after birth. Some pediatricians can do this by telemedicine, but sometimes it will be necessary for your pediatrician to see your child, to check the weight, to make sure that the child hasn't become jaundiced, and to make sure that everything is going well with breastfeeding. We also want all infants to get their vaccinations. It's very important that infants and young children be protected with these vaccinations. You know, immunization and vaccinations are really the public health success story of this past century. The rates of all vaccine preventable illnesses in the United States have dropped dramatically. Smallpox is gone from the world. Diphtheria, tetanus, polio, measles, mumps, rubella, and Haemophilus disease are almost gone in the United States. But we can't get complacent. We can't think, oh, everything's fine, because the germs haven't gone away. And travel and travelers are bringing these diseases back. So every child must be protected. And that's especially important during this COVID outbreak. So immunizations have to start early. Now, the good news is that babies are born with protection from their mothers. So at the time that they're born, they have the antibody, the protection from their moms against all the diseases that their mother is immune to. However, preterm babies born early, get less of this protection. And that's because the antibodies, the thing that protects you, goes across the placenta into the developing baby, mostly during that third trimester, right at the end of the gestation or of the time that you're pregnant. And furthermore, this protection isn't a permanent protection. So the antibodies from the mother, they are cut in half about every month. So that by the time you get to 12 months of age, most of that wonderful protection from your mother is all gone. And that's why we have to start immunizing children early. We want to protect them so that they're making their own antibody at the same time they're losing their mother's antibody. So what can we protect them against? And there are actually 16 different diseases. We're only going to talk about the ones that the vaccines that you get during the first 2 years of life. And that includes hepatitis B, rotavirus, diphtheria, tetanus, pertussis, polio, Haemophilus influenza type B, Streptococcus pneumoniae or pneumococcal disease, influenza, measles, mumps, rubella, varicella, and hepatitis A. So let's start with a vaccine that we give right at the time of birth. And this is a vaccine against hepatitis B virus. Hepatitis B virus causes infection of the liver. And if a baby is infected, the illness becomes chronic. And that chronic infection damages the liver. And this chronic infection also can lead to liver cancer. So it's important that we get this vaccine and that we give it early in life to prevent that early infection. So this vaccine starts at birth and it requires 3 doses total. The next vaccine we give is the vaccine called DTaP. It stands for diphtheria, tetanus, and pertussis. These are bacteria, and the diphtheria bacteria causes an infection in the throat that can be so severe that it causes a person to actually choke to death. It can also involve the heart and the nerves. Fortunately, diphtheria is very rare in the United States. Tetanus is a disease that's been called lockjaw. And in this disease, there are severe and painful muscle spasms that involve the entire body. Tetanus is also rare in the US, but only rare because we immunize, because of the vaccine. The bacteria that causes tetanus is present in the soil throughout the United States. Pertussis is a bacteria, the Bordetella pertussis. The disease that it causes is whooping cough. And whooping cough is most severe during infants. And that cough, which goes on for a long time, can actually last for months. So that those babies are coughing and vomiting and turning blue for weeks to months. So clearly we would like to prevent all of these diseases, and we do that by giving the first dose of this vaccine at 2 months. Haemophilus influenza type B is a bacteria, you might have heard it called Hib. And Hib is the bacteria that can infect the brain, the covering of the brain, the middle ear, the epiglottis, which is a structure that's in just below the tongue in the airway. And if that epiglottis swells up because it's infected, it again can block off the airway and actually choke a person. Lungs can also be infected, the heart can be involved, and the skin and the joints. Now in the 1980s, this vaccine first came out, and since then there's been a dramatic decrease in the incidence of Hib disease in the US. In fact, it's almost gone, but we know that if children aren't immunized, it can come back because this bacteria still exists in the US. Again, the first dose of this vaccine is given at 2 months. Polio viruses have been eliminated from most, but not all countries of the world. This is a virus that can invade the spinal cord, can actually destroy the nerve cells and cause paralysis. So this is a disease we don't see in the United States, but we know that it could come back into the United States. So we protect children with this vaccine, again, starting at 2 months. Streptococcus pneumoniae, or the pneumococcus, is a bacteria that can infect the brain, the middle ear, the lungs, the heart, the skin, and the joints. Now, there's been a dramatic decrease in this disease since the infant vaccine was developed and licensed in the year 2000. And much to everyone's surprise, not only did the decrease occur in children, but it also occurred in adults and in older siblings and in grandparents. So great news. This vaccine given to infants was able to protect a lot of people in the US. And the first dose of this vaccine is given at 2 months. Rotaviruses cause vomiting and diarrhea. And vomiting and diarrhea can lead to dehydration, which may result in the child having to go to the emergency department or to actually be hospitalized. There are 2 separate different vaccines available for rotavirus. These are both given by mouth, and the first dose is at 2 months. At 4 months, we give the second doses of these vaccines. So the DTaP, the Hib vaccine, the polio vaccine, the pneumococcal vaccine, and the rotavirus vaccines. And at 6 months, we give a third dose. And again, you can see these same vaccines are given for the third dose, and this is also the time for the third dose of hepatitis vaccine. Influenza viruses cause yearly outbreaks of the flu, and anyone who's had the flu knows this is a disease we would like to prevent. We also know that the disease can be much more severe and even fatal in young children and, of course, in older adults. So this vaccine is given yearly to everyone who's older than 6 months of age. The measles, mumps, and rubella vaccine is protective against those 3 viral infections. Measles is an infection that involves fever, cough, pink eye, and a rash. The measles infection can also involve the brain and the lungs and can cause very serious infection. The mumps virus causes fever and it makes your parotid gland swell. The parotid glands are right on the side of the jaw, and I think you can see in this picture those swollen glands. Rubella is a much more mild illness, but it's very dangerous for developing babies. So if a baby gets rubella before they're born, it can affect their brain, their heart, and their eyes. We give the first dose of this vaccine between 12 and 15 months of life. Varicella virus causes chickenpox, and that's a disease with fever and a very itchy rash. It can also involve the lungs and the brain. The chickenpox virus, or varicella, also stays latent within the body. So if you have those skin lesions of chickenpox, the virus can go to the nerve and can stay there and then come back years later and cause shingles. And shingles, as you know, is a very painful, itchy rash that occurs in a certain part of the body. The first dose of chickenpox vaccine is given at 12 to 15 months of age. Hepatitis A virus is another virus that infects the liver and causes hepatitis. Usually this is a fairly mild disease, but sometimes it can be quite severe. And since we started recommending this vaccine for infants, the amount of hepatitis A in the United States has dramatically decreased. The first dose of this vaccine is given at 12 to 15 months. So you can see there's a lot of diseases we can protect your child against in the first 2 years of life. And this protection is important now more than ever. Your pediatrician is doing everything possible to make your visits safe. They're using telemedicine, they're using Zooms, but they need to see your child in person to get them vaccinated. And they will do it in a way that's safe for your child. So please, don't wait for the COVID epidemic to clear. Get your child vaccinated today. Be sure that they're protected because we want them to grow up healthy and strong. Here are some websites that you might look at to get more information on vaccines. Thank you for giving me this opportunity to talk to you today.